Welcome to Dr. Z PhD Interviews. This is a place where I interview inspiring and very interesting people. And today I have a very special guest that I'm really, really excited to talk to. Jordan, welcome. I'm so excited to talk to you. First of all, you and I, we know each other. We know each other really well. And I love working with you. And I'm very stoked to talk to you today, especially about particular aspect of voice training. Jordan is licensed voice specialist, voice therapist. What is the actual proper lingo?
Yeah, so I'm a licensed speech language pathologist.
How important is it to be licensed, by the way?
I think it depends. I think there's awesome people that are doing this work that are licensed speech language pathologists, but I also believe there's people that are voice coaches and that also have backgrounds in music that are also doing amazing work working with the community as well.
Nice. I personally, this is my 2 cents, my experience. I would prefer voice therapists to be licensed because I also understand that there's damage potentially you can do to the voice if you don't know what you're doing. So I always side on the side of caution, and I prefer people that are licensed when I refer like yourself. So excited to have you on here. Share a little bit with viewers who you are. How did you get in this field? What population you tend to work with?
Sounds good. Well, thank you so much for having me here. My name is Jordan Jakomin, and I use he, him pronouns. I'm a queer speech language pathologist and yoga instructor, and I own a private practice where I primarily work with trans, non binary, and gender non-conforming youth and adults on voice and communication. And I got into this when I was 20 years old. I was at a conference and I saw a poster board presentation on transgender voice therapy, and I immediately went back to my undergrad and I was like, this is amazing. I want to like specialize in this. When are we taking a class on this? And they're like, there is no class. And I was like, what do you mean there's no class? And so I did my own research on Google and I found the one book that was written at the time on it. And I actually have it around here. It was written by Dr. Adler and Sandy Hirsch. And I got the textbook and then I called the author on the back of the book. And I was like, hey, can you please help like be my mentor? And 10 years later, I am, and it's funny because I just had a meeting with him today, earlier today.
Amazing.
And he's been a mentor, and I've had a lot of other mentors along the way that have kind of guided me. I first started off as like a volunteer, just working with LGBT centers and running voice and communication workshops. And then it was like 2 years ago where I decided to open my online private practice, and it's been amazing so far. I'm so grateful to be doing the work that I'm doing.
Congratulations. It's a big, big deal. Do you ever wonder why there's such lack of resources? I mean, you went into research and you pretty much just found this one text on voice training for queer community. Why is that?
Because trans people existed, so they always have, and so
Right.
they're the people that have been doing the work have been doing it since the 80s, 70s, and 80s. So to still have the lack of education to educate speech language pathologists is frustrating, but I would say it's changing. So a lot more programs around the United States are incorporating gender affirming voice work in the curriculum. Even some universities have where they will welcome the trans community, non-binary, gender non-conforming speakers, and then have student clinicians working with them. So it's kind of a win-win both for the clinician to acquire those skills in graduate school, but also for the community where it's lower cost services. So
Mhm.
there is definitely a change. It's slower than I would like, but I think
Yeah.
it's making its way.
Yeah, it definitely slower. So you work with all kinds of population. You work with adults, you work with youth, you work
Mhm.
with trans femme identified, trans masculine identified, non-binary individuals. So pretty much you cover voice modification along the gender spectrum, if you will.
Yes.
Okay.
Hmm.
Let's start with trans femme individuals. And I'm curious to hear what are your thoughts on working with trans femme individuals in the sense of what do you think are some of the biggest mistakes trans femme tend to make when they start voice therapy or even before they start voice therapy or in the relationship to voice therapy?
Hmm. Well, I think that sometimes I wouldn't necessarily call them mistakes because everyone's on their own voice and communication journey, and everyone has different knowledge base from whether it's from YouTube videos that they've watched before. And there are some great YouTube videos out there that are helpful, but some can kind of give misleading advice. So two big things that I would think. One is going too high in pitch and
Mm.
thinking that in order to sound feminine, you need to have a really high pitch.
What
So
would that
that's,
sound like? Can you demonstrate what that would sound
yeah,
like?
hello, 1, 2, 3, 4, 5.
Mm.
So just going really high in pitch,
Really?
but then not
Mm.
working on resonance. And resonance is how we modify the shape of our throat, our mouth, in order for the sound to come out as brighter or lighter and deeper or darker. I can give you a demonstration of this
Yes.
if you want in a sec. And so I will actually right now. So for example, like pitch is one thing, and so going high in pitch, but we can have a pitch that's in a neutral zone, like for example, the note F3 on the piano. Want to hum there and feel what that feels like?
Okay.
So I'm gonna say A, and I'm gonna say it at the same pitch. First, I'm gonna do it with my larynx low and my jaw low, my throat open, and then I'm gonna do it changing my resonance, changing the shape of my throat and mouth. Listen to how different the sound comes out, dark versus light. So first, I'm gonna go dark. Now I'm gonna go light.
Oh,
A.
wow. Yeah.
Hear the difference between that? So
Yeah.
that's resonance. So the pitch didn't change at all. The pitch was still the same. The only thing that I changed was the resonance of my voice. So
So
the
resonance
position
is
of,
more important than pitch.
yeah, I think so. And I think pitch, I mean, pitch is still important, but resonance is definitely one of the key aspects of finding a voice that is affirming and authentic. And it's going to be different for everybody.
Right.
So, yeah.
Right. That's another thing that I even have don't feel that I need to mention this because my viewers know me so well. But for those who are new viewers on here, that clearly we're talking about voice training for those who prefer it, for those who have dysphoria about their voice, for those who are really looking forward to passability. Passability is not for everybody, and it is very subjective. It varies. What passability to one person, very different what it means to somebody else. So we're not trying to stick to gender stereotypes here and say that women need to sound like this or men need to sound like this or non-binary people need to sound like that, right? Because I assume when you work with people, when they come to you, like trans femme, for example, do they usually have an idea, a concept to what they want to sound like, what their feminine voice is?
Some do and some don't. And it's really cool to see how it can change over time. And I always let clients be in charge of their voice. It's not my job to dictate how somebody's voice is, it's their identity, and
Right.
they're always in control. I always say, you are in control, and I'm going to guide you on your journey along the way. I'm going to show you all the tools and techniques that you'll need in order to find a voice that feels affirming and authentic. And you get to choose where to go. So, for example, like somebody can end up with a higher pitch and then have really forward bright resonance and have it be where it's a like a feminine, and I use the word feminine because what even is a feminine voice, what even is a masculine voice? So like,
Exactly. Sure.
so they have, but then they're like, wait, so I'm up here and it's super bright, really high, really light, but I actually like it down here better. And so we'll go back, and that's okay. There's nothing wrong with that. But to give people the safety to explore and to not feel judged doing it is something that I find really valuable in sessions. And then having it be, yes, I'm going to give feedback, and yes, I'll be a coach along the way, but to let them take ownership of the voice. My job is to help my clients become their own clinician. So I'll teach them the tools and techniques on how to analyze their own voice, how to analyze their own pitch, their own resonance, the vowel modifications, and then they are in control as opposed to somebody else being in control of their voice.
Okay, I like that a lot. What is the biggest, I would say, exaggerated, unrealistic expectations that you see trans femme individuals come in voice training with?
You know what? To be honest, I haven't had too many unrealistic expectations. I think the just biggest one is pitch. So if you go too high in pitch, what happens is you have a limited pitch range. So say if somebody wants to have a pitch like up here, 1, 2, 3. Well, when they're saying something that has upward inflection, like Are you thirsty? Are you thirsty? They need to bounce high on the E in thirsty. And if they're already starting at a pitch that's too high, they're not going to have any upward movement. So just educating them on that. But once again, not being in control, not telling somebody, I can't say, you can't do that with your voice. I'm not going to allow it. No, they get to pick. If they want to be at that B3 note, then they can be there. It's not, I will tell them maybe the pros and cons of being there, but in the end they're in control. So I think that's one area that I've worked on that comes up a lot, is sometimes people have expectations of wanting to go too high and hertz and pitch up the scale,
Yeah.
and me kind of showing, okay, you're not, let's just practice it in this note, and you're not ever stuck here, you get to pick and choose, let's flow around. But do you see how maybe at this note that's a few notes lower than this, that you're able to make upward inflections without your voice breaking at the top, and then it's also easier for you to maintain for our whole conversation. So yeah.
It sounds like it would be very unnatural to talk in that high pitch all the time, strenuous too. And it sounds as if it would be very hypervigilant in a sense where you're constantly thinking about
Mm-hmm.
speaking in that versus finding a real range that works for you, that you feel comfortable with, it's settled in.
Yeah, definitely. But just even in the neutral range, which is like an E3 on a piano to G3, like around here, 165 hertz.
Mm-hmm.
Even that's a really good place to start if you are, say you're speaking down here at like a A2. One, two,
Mm.
three. Hi, my name's Jordan. If you bounce up too high up the scale, it's going to be straining for your voice. So you slowly and systematically want to work your way up. So even in neutral zone like D3, E3, F3 on the piano, it's still going to be something that you're going to have to think about constantly. It's hard, but there is going to be a day where it does click, and the thinking takes place a lot, definitely within the first like few months. But over time, if you're using your voice consistently, it's totally possible that you're going to create your new voice, feel affirmed in your new voice, and then not have to think about it all the time. But there's definitely thinking about it is definitely part of the process.
Yeah.
Um, mhm.
Yeah. So what's your gender identity? How do you identify gender wise?
I'm cisgender.
Okay. So cisgender on a
Uh,
spectrum.
yeah, cisgender man.
Okay. How do you think your own gender identity, does it actually help you in working with trans femme clients, or, do they see you as intimidating because they feel that you won't understand, as somebody that has a masculine voice, you won't really necessarily understand the range they want to go to, or to the opposite, they see you as actually somebody who would really understand because you already have those vocal cords or that kind of starting point where a lot of them tend to start out of?
Yeah, I think it's a really good question to ask. I think just helping my clients feel safe and that they know that I'm a safe person to work with. And I think um, just making them feel comfortable working in sessions with me is super important. And for me, it's more of like a soul based thing that I want clients to feel comfortable and um, based off of who I am, not so much my gender, but it does make sense that I haven't had like an issue come up where somebody, maybe people haven't reached out or had a consultation with me because of my
Mm-hmm.
gender identity. But I also don't, one thing I don't do is go, oh, I know exactly what you're going through. I will
Right.
never say that to a client because I don't know what they're going through. But I do want, for this reason, for this life I'm in, this is the work that I was called to do. And I want to do everything I can to not only like help transgender, non-conforming, and non-binary people like find their authentic voice, but help with trans liberation in general. This is a calling of mine, and so I just want to do what I can to help the community and just make them feel affirmed. And I think what happens though, initially when somebody has an initial consult with me, they can be super nervous and anxious. And I think if they feel comfortable with me and know that this is a judgment-free zone and I'm gonna like support you and I'm gonna kind of be a guide on your journey, I think my gender identity doesn't necessarily get in the way of the work that I'm doing.
Yeah. How long does it usually takes to I know this is very subjective because feminine voice has a wide range in terms of what it even means to individuals. But generally speaking, for voice training, how long does it take? At what frequency? Like hypothetically, give people
Yeah,
some
no,
kind of
it's
an
so
idea.
yeah, no, like 3 to 6 months usually. And it's so dependent on what the person's schedule is, what they're going through in life. But I can pretty much get not everybody, but a lot of people through within like 12 sessions. So once a week, but they have to put in the work. So at
Yeah.
least like 5 to 10 minutes of practice per day. So short, frequent bursts of practice are going to be a lot more effective than practicing for like 2 hours once a week,
Hmm.
but I could see pretty good results with clients within a few months. And then here's the thing about the thinking about it. So they have their voice after like 3 months of working consistently with me, but then they're still having to think about it. So that part can take longer. That I don't know, maybe a year, 6 months, but they have the voice,
Yeah.
but just the day where they wake up and they're like not having to constantly think about their voice. So that part can take a while, but remember what I said earlier about helping my clients become their own clinician. I don't want to keep them on for a year. I don't want them to waste all their money on voice training. I
Right.
want them to get through and like get through the program. And so with clients, I have an individualized approach, but I also do have it where it is can be systematic. Like they're provided with around like a close to a 50-page workbook, so they're not having to like feel like they need to memorize all these notes that we're going over
Hmm.
because what it is, it's a mix of like art and science, and then I also do offer like a holistic, like kind of perspective to it where I do incorporate yoga, meditation. I'm not afraid to go into counseling because our voices are so connected to our voice,
Hmm.
or
Our
and
bodies.
yeah, our bodies are so connected to our voice, um, and just being able to help people feel comfortable and at ease. If someone's stressed, their voice is going to lock up, but if I can help them relax and be at ease, it's going to allow for their voice to come out freely and authentic.
I'm glad you mentioned that. I did a video on that too, where I recommend you have to start voice training early on if that's something that's important to you. Because you're right, you master the voice. It may not take a long time, but making that psychological leap where you're not constantly thinking about it and you're not in that headspace where you're having that mindset of where it's really integrated as part of you takes a while. Yeah, and it varies from people to people. You ever see people you work with where they just throw in the towel, they just give up, they say, screw this, I'm going to consider vocal surgery. This is just too much. It's too much work. You ever see people give up?
A few, but usually not a lot. Sometimes people will take breaks for mental health, which I completely like support and like am fine with. Of course, if somebody needs to take a break, I'm not gonna
Hmm.
force them to show up every week. Like take your break and then come back. I have had clients that have gone through and then have maybe thought about doing the yeah, like the when their glottoplasty
Yeah.
procedure. And so my job is to I guess counsel them on like what to expect during surgery, some risks that could potentially take place, and then but I haven't had too many. I would say out of all of the people I've worked with, I don't know, 2 to 5% have maybe
Yeah.
stopped and thought about that.
You ever had people who had vocal surgery and it wasn't very successful come to you for voice training?
Not yet, not yet. But
Okay.
I would be open to it, but
Yeah.
uh, but not yet.
Yeah, because it's not always a success for everybody. It doesn't deliver expected results for everybody across the
Hmm.
board. And there's
Yeah,
definitely, cons for sure.
yeah,
So apart from trans femme, you also work with, which is fascinating to me, you also work on masculinizing voice as well, right?
yeah.
And I think that that's a niche in of itself that is very underserved. I think a lot of people rely so much on testosterone to deliver the deepening of the voice. And for a lot of people, testosterone just doesn't necessarily end up doing that, right?
Hmm.
So people just don't consider, just not even aware that there's an option to masculinize voice. So what is masculinizing voice?
Yeah, what even is a masculine voice? What even is a feminine voice? So it's like those big questions. But yeah,
Conundrums. Yeah.
working with I'm super passionate about working with transmasculine and non-binary clients, and so what it is so I like to show people all of the options that they have, what your voice can do. So when working on, so I kind of like to categorize it as creating a brighter, lighter voice or a deeper, darker voice, or a combination of the two if that's your jam. So, like with creating a deeper, darker voice, what you want to do is have a go down the scale in pitch. So that's one thing. So when we go down where the vocal folds are getting thicker, and creating more resonance in the chest. So resonance, I kind of like to categorize resonance as two different things. So you have conductive resonance, which is how sound vibrates in the body. So and only if you feel comfortable, you don't have to do this, but if you put your hand on your chest, and if you say in a lower pitch,
In a lower pitch.
uh-huh,
So it will
you'll feel
be not a higher pitch. I always confuse the pitch. Okay. So
you'll
oh,
feel
I can
more
feel the,
vibrations.
yeah.
Now that's because the vocal folds are getting thicker and it's creating more sympathetic vibrations here. Now, if you do a higher pitch, which is going to stretch the vocal folds, and you go me 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 me, put your fingers near your nose or lips, me 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 me, you'll feel more vibration in the mask of the face. And so that's one way of working on helping people create more resonance felt in their chest. So that's more of the feeling, but also there's acoustic resonance. So this is modifying the shape of the vocal tract. So changing the shape of the throat and the mouth in order for the sound to come out as deeper or darker. You can think about this as like a violin and a cello. So a violin has a smaller space. So the sound that comes out of a violin is brighter or lighter, whereas a cello has a bigger space. So the sound that
Ah,
comes out of that is going to be deeper, darker,
interesting.
richer. We're
Yeah.
instruments, literally. So if I can teach my clients how to open the spaces in their mouth and throat more, lower their larynx, and then in order to create a deeper or darker resonant sound. It's kind of like the A that I did before when I went A, and I didn't change my pitch, but I just changed the spaces inside of my throat and mouth
Oh
there.
my
And then
God.
yeah. And then on top of just resonance and pitch, there's also intonation patterns, which I don't like to label as necessarily masculine or feminine, but I do like to talk about staccato versus legato. So legato is more connected or blended. Can I have the apples, oranges, and bananas versus can I have the apples, oranges, and bananas?
Who
So
talks like that? Both of those sounds are nature. Who talks like that?
yeah,
Are we socially tend to attribute one to feminine and one to masculine?
a lot of people do, yeah. A lot of people will say I've had clients that I've worked with some other people in the past that said that they need to always upspeak. So talking at the end of phrases like this to sound more feminine, which is not the case. If somebody does want to use upspeak, that's okay too. But just be aware. That's why I really try to stay
Hmm.
away from saying this is masculine and this is feminine, or oh, you
Right.
sound so feminine, you sound so masculine, because
Yeah.
I've had clients that want the deeper, darker resonance and want the lower pitch, but they like the legato. So they like to blend and go, can I versus can I? There's not one right way. So what I want to do is show people all the different ways of intonation, all the different ways of resonance, all the different ways of pitch, and then find what feels affirming and authentic for you.
Yeah, I haven't noticed that. That's interesting. I haven't, and obviously part of it is I'm not paying attention, right? So when it's not something that's concerning to you, you're not going to be putting emphasis or attention on it socially. But I haven't found this emphasis on different words in terms of gender stereotype. I have found there's a little bit of emphasis that I feel with more stereotypically female clients. There's tendency to use much more emotional language. And so to describe or to request something, it'll be a longer sentence that has more
Mhm.
emotions embedded in it versus a more masculine would be shorter to the point, more direct. But again, I also witnessed it in all kinds of genders. So
Mhm.
interesting. So if trans femme tend to make a mistake of going too high in their pitch, right? If it's trans masculine, what is the mistake you see them make?
Yeah, so one could be going too low, pushing the voice too low, where it's not going to be good for the vocal fold. So going too low, pitch, not using enough breath support. So
Hmm.
breath is our power for speech production. So if somebody's speaking on limited breath support, so I work a lot on breathing techniques, and so if someone's speaking on limited breath support, they're most likely not going to have enough air to finish their thoughts, have vocal fatigue, and have decreased volume. So that's a thing that I see a lot, and this is super interesting. So like with some of the clients I have worked with, so they've taken tea and it's been could be years, so their voice has dropped like about an octave. So for example, say their voice started up here, 1 2 3, and then it goes here, 1 2 3. So their vocal folds got thicker What
Mm-hmm.
happens is sometimes behaviorally, even though they have access to those lower pitches, they still are speaking at a higher pitch using more of that resonance from the head
Ah,
and fronted. And so helping them just to gain awareness of reaching those lower pitches behaviorally. And then also with some clients, it's like they have their vocal folds from testosterone got thicker. So they are able to speak at a lower pitch. Hi, I'm Jordan. But testosterone doesn't change the shape of the throat or the mouth. So they still have smaller violin kind of, remember the violin kind of
oh,
spaces. So they
uh-huh.
have thick vocal folds with smaller spaces. So
So,
it adds,
so sorry to interrupt. So, testosterone will thicken the vocal
uh-huh,
cords. It just makes it thicker, and because they're
that's
thick,
it.
and because
Hmm.
they're thicker, the voice tends to sound deeper,
Yes,
but the
exactly.
space is the same.
Space is the same. So you have a buzzier sound with a higher, brighter space. For some people, though, it's okay. They're completely fine with that. So if you're, there's no, just give it like there, not everybody who is on T or who is, needs voice training nor wants it, but for those who do, I just want to be a resource. So teaching people how to access their lower pitches safely, but then also how to modify the shape of their mouth and throat so we can create bigger spaces and get the sound to be darker. Yeah.
Huh. So, what does it sound like if your vocal cords have thickened, but your
Mhm.
pitch is still the same? What would it sound like?
Yeah. So like, so if your vocal cords have thickened but your resonance is still the same,
Right.
yeah, it's going to be different for everybody because we all have different instruments. But I'll kind of give you an example. It might be having a lower pitch, so like 1, 2, 3. It's more forward.
Oh,
One,
I see.
two,
Got it. It almost
three.
sounds like nasally congested a
One,
little
maybe
bit.
a little nasally or just brighter
Yeah.
versus 1, 2, 3. But somebody not want a big space either. So they want to keep in mind, please keep in mind that I wasn't generalizing for everybody with those different samples just because my vocal tract is different than others and my vocal folds are different. So,
Yeah,
but
but just to give an example,
yeah, one
right?
example is going to be that
I wanted to hear
sound,
what that sounds like. Yeah.
fuzzier, brighter. And so what happens with some of these clients that I work with is that even with the pitch drop, they're still getting maybe misgendered on the phone, or they are like perceived as younger than their actual ages. So it's totally dependent on the individual. And for some people, testosterone just straight up doesn't have the effect that it has on the vocal folds.
Oh my God. Interesting. So complex. It seems like a lot of biology and understanding, and you clearly also have to understand the effects of testosterone that has on vocal cords and all of the things.
Hmm.
Yeah. How difficult is it to masculinize voice, or would you say it's just equally as takes the same duration time it does to feminize voice?
Yeah, I mean, I think it's different for everyone. I think it's definitely not impossible. It's definitely doable. So it depends because some people I worked with have not started taking tea or don't want to take tea at all. So what I'll do is teach them all instead of going super low in pitch because their vocal folds won't allow them to go to the B2 or A2. This is too
Mm-hmm.
low. So we'll go to a more neutral zone on the scale and then teach them the techniques for opening the throat, dropping the jaw, and then also the intonation, and they get to pick and choose. But it's definitely possible. Now, for some people that have been on tea for a while or in the process working with me taking tea, it's similar but approaches, but different ways of doing things. So I think it really depends on how much work the person puts in at home and practice, and then what's going on in their lives, and if they're able to find a way to relax and be able to.
And you have specifically workshops you're going to be launching on your website to masculinize the voice that is coming very soon for those who are watching. Very excited about it. So what is it something that people can just purchase like online class, do it without seeing you individually for one-on-one? How is it structured?
Yeah, so I'm super excited because I just created like a 10 module course that's going to come out next month. And so it's pretty cool because I'm going to teach basically And this one is for creating a deeper, darker, or more masculine voice. Hopefully, in the next few months, I'm going to do one for creating a lighter, brighter, more feminine voice. Whatever you want to call it, you can call it whatever you want because it's their voice to label.
Right.
But the first module is like me teaching clients how to do their own self-assessment so they know where their starting pitch is at. So whether they want to go up the scale or down the scale, they're doing it safely. Remember how I was talking about how one of the areas that people struggle with at first is going too high in pitch or too low? Well, teaching somebody how to do an acoustic assessment on their voice is going to show them, okay, based off of the numbers that you have here, you're going and I walk people through how to use apps, and it's live on the video. So I'm there with the video and you see the app in real time. And I teach you how to use the apps, how to do your own assessment. And then we'll talk about vocal health, which is cool, pitch exercises. I incorporate my background in yoga and do some like relaxation stretches, connecting mind, body, and breath.
Very
It's a huge,
holistic.
yeah, try to be. I love incorporating that in breathing techniques, resonance, intonation, and then vocal actions like laughing, coughing, sneezing, throat clearing, combining all of the elements that we discussed and doing a final assessment. And so my hope is that it's helpful and that people can kind of at least get started on how to walk themselves through creating a deeper, darker, and more masculine voice, and then be able to have the tools and techniques to get started and really find a voice that feels affirming for them. So I'm excited.
Are we going to be able to see the trans femme modules from you as well? And
Yeah,
non-binary
yeah,
modules?
I definitely am going to start creating those soon. And I wanted to give myself a break, do some because after
I
a
know
few
you've
years of
been doing a lot of speaking, a lot of engagement. You just recently got invited to speak at the Philadelphia Transgender Conference, right?
yeah.
Which is a huge, huge deal. It's a very big conference. It's a tremendous achievement. So you've been really busy teaching and educating.
Thanks. I'm super excited and passionate about it. I love educating, like, so I love being able to present at like different LGBT centers and still doing like workshops there. But then also, I'm super passionate about educating other trans affirming healthcare providers about the role of the speech pathologist
Yeah.
in what we do, because I want to spread awareness about this still, because still, I notice that in a lot of gender centers, they have the counselors and they have doctors, but there's not speech pathologists working. I would love to be a speech pathologist working at a gender center, and I think it would be awesome. So I think in the coming years that's gonna hopefully happen. I'd love to help build a
I see this. I
program.
see this for you. I definitely see this for you. Yeah, it's
So
very important.
yeah, but I love presenting. It's something that I'm passionate about, and I'm super excited and grateful for the opportunities that are coming up.
So jumping gears to non-binary voice, when you have non-binary people come to you, what is the biggest request pattern-wise that you tend to hear from non-binary people in terms
Um,
of how they want to sound like? I know it's again very subjective, but um, I know a lot of non-binary people who respond on my channel, and one of the biggest challenges they tend to continuously express is how to move toward medical or surgical transition when a lot of times they feel their gender expression and identity tends to be more gender fluid and tends to fluctuate from one to another. And
mhm.
I understand this voice, obviously you're able to do that safely without really, having any kind of permanent type of things happening to you. So what do you think is one of the biggest requests you find non-binary people?
I think in general, it's just wanting to feel more confident and affirmed in who they are. And so I will do that not only with voice exercises, though, too. Like, yes, I'll teach people how to go up the scale, down the scale, brighter resonance, darker resonance, intonation. A huge part of the work that I do is helping clients like connect and to be kind, love themselves more, like be open to kind of the holistic stuff that I put in, like with the meditation and stuff. And so I think a big part of my job, aside from the cool voice exercises we do, is getting people to overcome their limiting beliefs and like putting like just being able to like close your eyes, put your hand over your heart, and just like take a breath and like
Mm,
say, I'm enough. And
mhm,
like
mhm.
and then that's huge in itself, more important than I think than the voice exercises. Because
Yeah.
if you have a voice, but then are not happy or not affirmed. Yes, we have life moments that happen where we're not always going to be like good vibes and everything's fine. And I get that. But if I can help clients wherever they are in their journey in life to just feel more affirmed in who they are and walk in the world with more confidence, authenticity, and loving themselves more, that's the goal. So
Wow.
more than
So, with people who come to see you all across the board in terms of their gender expression, gender presentation, how much would you say is there's this huge stress factor as a result of voice or as a result of not really sounding how they want to sound? How much do you see that causing them, increased dysphoria, stress, voice, all of that stuff?
huge, yeah, huge.
Huge. Yeah.
That's why honestly, because that's such a big part of it that I'm seeing. And so that's why I've been getting certifications in yoga and in Ayurveda and literally considering going into counseling or social work because it's so connected. And I think if I just were to do voice exercises and be like, all right, bye, see you later, and
Mhm.
that was it, I wouldn't be doing my job. And
Yeah.
so I think stress is a huge factor. And yeah, and being able to be a light for my clients and be able to help them calm their nervous system, connect mind, body, and breath um, is so important to me because, yeah, a lot of my clients are stressed and I don't blame them. It's a stressful thing to do, it's a vulnerable thing to do to work on voice and communication and just in general. So it's totally common if you're stressed about your voice. I just want to help people be able to relax and calm down and find
What do
peace.
you usually say to clients who tell you that, Jordan, I really want to work on my voice and practice my voice, but every time I hear myself and I hear what I sound like, I get very, very dysphoric and I get very uncomfortable. And a lot of my own, I know for a lot of people, a lot of their inner transphobia tends to come up because they feel they sound like they're pretending to be versus
Mm.
actually getting to the destination. What do you tell them when they tell you that?
Yeah, one thing is that I'll never like force a client to listen to like the recordings of their voice if they aren't ready yet, but to give them feedback because sometimes I will tell you like sometimes voice training is going to sound awkward, especially in the beginning weeks. And so one of the things I say and like the only way out is through the process, but being kind and also validating that yeah, it's okay to feel how you're feeling. It's part of the process, but to also just be patient and um, to step away from voice training for a few days and come back to it when you're ready. And usually, because there are people that they are uncomfortable listening to their voice recordings or uncomfortable, but part of the process is being uncomfortable. But I need to find too, I'm working on it too, like what are the limits of how far I can push a client where I'm not like forcing them to do something that they want to don't want to do. So always having the client be in control and just being support system for them.
Yeah,
But
I can only imagine how self-conscious the whole process is because when you were demonstrating for me, right, that inner what did you call it, inner rhythm, inner frequency, I was feeling very self-conscious demonstrating that, and I can only imagine how people feel very self-conscious. There's an element of being very, very self-conscious when you're doing voice training. How do you create a space where people feel more comfortable?
I don't know. I think just being myself and just uh, yeah, I think being not like yes, I'm a clinician that I have this dream, but I'm also like a person. And I don't need to like I'm friendly with my clients. I don't need to put on this like yes, you do this exercise like talking about life. And when I open the sessions, like what's been going on, like how is everything going, and then also for me like I only if clients are open to it, like I really they get more of a coach because for me I want them to like if they feel comfortable like send me recordings of your week, talk to me about what's going on in your life, like because one yes that is like a form of like counseling as well, but that's me, I'm listening to their voice and giving them feedback on
Yes,
it. So
very
I,
essential.
and then giving clients time to get to know me, not forcing them, like getting when they, and I think after a few sessions, usually people, and I can't speak for everybody, but people feel pretty comfortable and, and safe working with me. And I think just getting to know them and who they are, listening to their stories, sharing personal things about my life, which I'm okay
Mhm.
with, and just being a good good person. And I think that's a way to connect with
I love that. That's
people.
such a great answer. That's really, really good answer. I was going to also ask you, when do we expect a book from you that tends to incorporate this holistic approach, that tends to incorporate all of these aspects of psychology in the sense of how to distress yourself, being aware that you will feel self-conscious, you will feel uncomfortable, reaching that element of confidence and feeling very affirmed about yourself, because otherwise, if you don't, all of this really doesn't really matter. You can speak in the most fast sounding voice ever, but if you don't feel confident and affirmed in your gender, what is the point? I think that would be such an amazing book where that combines all of that understanding for people. So when do we expect that from you?
Later in life, for sure. I feel like I want to have some more life experience and keep diving into um, the. Yes, I understand the parts of the voice and the anatomy and physiology, but now I'm really diving into the mind, body, soul stuff. And so to read about it is one thing, but to live it is a different thing. So to practice what I preach. So when I'm telling my clients about meditation and about like affirmations and about self love, I need to apply that to my own life as well. So I think just living it a little bit longer, getting some more experience, and doing some more trainings in like the holistic healing realm, and I think one day I'll make it happen. I hope so.
I know you will. I love it. I feel that you're such energetically. I feel such an amazing, huge heart and huge amount of energy coming from you. Every time I talk to you, I feel incredibly comfortable. And I know that people who are watching this, it definitely comes across. I'm going to link all of your information below. Now, your classes are not coming until some weeks from now, right? They're not going to be launched
Yeah,
right away,
next
but they're
month.
next month, but they're definitely coming. And then we'll be expecting classes on feminizing and also non-binary voice from you as well.
Yep, definitely those classes. And then if anyone's interested in signing up for a consultation, they can do that on my website, or and then I could help support them like on a one-on-one basis. So
So excited to have you on here. Thank you so very much for taking your time and sitting down and talk to me and explaining all of this and all the technicalities, all the complications, and all the little nuances of voice therapy. It still sounds very complicated to me. A lot of it goes over my head. I'm glad I'm not a voice pathologist and specialist. It's not my forte, but it's really fascinating. And I think the work you do is incredible.
well, thank you. It means the world to me, and I'm grateful to have done this interview with you, and I'm grateful for our friendship, and thank you for everything.
Mhm.